Tired of dealing with vein disease? Have your symptoms gotten worse?
Oh, these spider veins are ugly.
My legs and ankles are always swollen.
My legs are tired of standing all day.
While some symptoms can be managed by lifestyle changes, other factors are out of your control. Get help from the experts at Vein Clinics of Hawaii. To learn more about your treatment options, call 427-5565 or visit veinclinicsofhawaii.com. Aloha Hawaii! It's time for the Vein Clinics of Hawaii radio show. Their team's approach to diagnosing problems and developing solutions and treatment plans are beyond compare. So let's get started with your host of the show, Mike Buck, and Medical Director, Dr. Randall Juliff of the Vein Clinics of Hawaii.
Well, hello there, and welcome once again to the program. You know, we've been doing this show a long time, and as a matter of fact, we went way past the 100 mark a while ago. And one of the first things that I learned, because not only am I the host of the show, as many of you know, but I'm also a patient, is that we always talk about compression stockings. And I thought, you know, every now and again, I'm trying to second guess the doc and find out when those words were going to enter into the program for the first time each week we do the show. How about minute number one? I can't believe it. I'm so excited because I've become a believer. I've been wearing compression hose now for a couple of years. It's made a world of difference in the way I feel, and I know I'm going to influence some people today. And it's not just about feeling good; it's about being healthy. And since we're going to talk about that, Doc, I don't have to time you because we're going to start talking about compression stockings all the way. First of all, let's explain a little bit why a person would need a thing called a compression stocking. What are they good for? What do we use them for?
Well, I like to talk about compression stockings, periodically because they're such an important part of our ability to treat venous insufficiency. Nearly all of our patients are in compression stockings at one point or another. Compression stockings are not just another pair of socks. There's a great deal of...
There's a mental thing about that. We'll talk about that a little bit.
Yeah. But there's a great deal of engineering that goes into the construction of these stockings, and they've played such a vital role in our ability to treat people with vein disease. We talk about compression stockings in the same way that we would talk about a medication. For vein disease, stockings are as important as taking an antihypertensive for high blood pressure or a glucose lowering medication for diabetes. I mean, it really is a medical therapy, and a lot of people don't feel that way about it.
I agree, and then I was going to say that, and one of the things, gang, if you notice now, it's crept into the sports world and into a lot of other places too. And a lot of young people are using these not for vein disease, but for energy and for just being able to continue keeping on and all of these things. But I think if we go back, and what I wanted to do when you sent me the notes about the program, I thought, wow, we can go back to day one. I mean, this theory has been around for a long time.
Right. Yeah, the history of compression stockings is kind of interesting. When you look into the history books, the concept has been around for quite a while. As a matter of fact, it dates back to about 5,000 years BC.
Oh, jeez.
So that's a long time ago. And there apparently are cave drawings. I haven't seen a picture of those, but cave drawings of soldiers with their legs being wrapped. Very likely with something, whatever they had back then.
I would wrap my legs because I wouldn't want you to hit me with your sword and cut my leg off. So I would imagine some of it was armor.
Some of it was armor,
but maybe not all of it, right?
But right. Yeah. Exactly. They whatever the drawings portray, apparently it was not just for injury or protection or related to war itself, but very likely it did have to do with the functionality of their legs.
Well, so, maybe where did the words foot soldier came from? Guy on his feet.
Well, absolutely.
And if they're going to go hundreds of thousands of miles, there's some wear down breakage.
Some benefit to the the ability for them to do those types of things, like you alluded to before. Just a minute ago, athletes will use not a version of a compression stocking. We normally refer to it as a sleeve because it goes from the ankle to the knee, so it's really compression primarily of the calf muscle, but they wear those for muscle recovery. They've found that when they're exerting themselves, especially these high energy kind of athletes, long duration kind of athletes, they benefit from that compression because the muscle is recovering from muscular activity quicker, and very likely maybe that's what they were addressing.
Yeah, and some of the things that I've looked at is like basketball players, a lot of them are like guys that are doing weightlifting squats and all of these things. Having that compression gets that blood going back up to where they need it. It's sort of interesting because you've explained on previous shows. I've always whacked. I just can't believe this one is you don't really have a lot of blood in your body.
Right.
And I've learned from Dr. Julep and so a lot of you, this stuff moves around pretty quickly in your body, doesn't it?
Yeah, it does, and that's and that's the issue with venous disease, because in venous disease of the lower extremity, the blood hangs out too long. There's too much blood, and the blood is hanging out too long in the legs, and that's what compression stockings addresses. It helps the blood go back up. But so 5,000 years ago, they saw these these cave drawings from 5,000 years ago. There's something called the Ebers Papyrus, which is an ancient Egyptian writing pertaining to surgery and medicine, and that was from 1536 BC, where they discuss more specifically mechanical compression therapy for the legs and the benefit thereof. So I go way back, and that's a little more specific. Even more specific is Hippocrates. Everybody knows Hippocrates. The Hippocratic Oath. He was an ancient Greek physician. He was born 460 BC, so again, a long time ago. But he was a very, very bright guy. He was the first one to really start to talk about medicine in a more scientific, rather than I think conceptual or kind of spiritual sort of way. But some of his writings had to do with tight wrappings of the legs and the benefits thereof. Hippocrates actually kind of connected vein disease and what we call today venous stasis ulceration, and noted the benefit that people get from compressing the leg in one way or another as a treatment for that and for their underlying vein disease.
Well, one guy said the reason why he uses the stockings is he has such great relief when he elevates his legs. But he's not able to time-wise devote the time to elevation that he'd like to. So what's happened is that sometimes, remember you said in the very beginning, and gang, if you've been listening to the show for a while, you know that when we talk about these things, they creep up on you very, very slowly. But we have these innate sort of feelings in our own body that we know what makes us feel good. So elevation makes us feel good. So if you're getting the same feel good, but you can't go elevate, somebody that discovers this says, I'm a believer. We're going to convert a few people today, I think.
Well, and we use those questions too when we evaluate people. One of the questions that we ask is, do your legs feel more and more tired as you go through the day? Do you go home and you feel like you need to elevate your legs? That's a perfect sign of probable venous insufficiency. And in the same way, when we're trying to figure out what symptoms a patient is having that may or may not be due to venous insufficiency, sometimes it's not completely clear. Often we will say, we're going to put you into compression stockings and let's see how that affects that symptom or another. And if the compression helps that symptom, then we are a little more able to chalk it up to venous insufficiency.
But it sounds to me more and more like it is a very important part of the arsenal that you use to employ to to work on this condition, because it may not be providing a surgical thing or something, but it certainly is going to hold you at bay until you can get some treatment. So,
Yeah.
and I had to do that. Remember, we can explain this later. I had to do that to be able to qualify for some insurance. They had to know that there's been every effort made by the patient, by the doc, in determining, well, we have to do something surgically to this guy because elevation and compression don't do the trick all by themselves.
Yeah, he hasn't fixed it.
Yeah.
He hasn't fixed it.
Good.
So the next stop along the history way is a guy named William Harvey, who he lived back in the 1600s, and we talked about him once before. Well, a few times before, but one time before in particular, because he really kind of brought into light the circulatory system. He really was the first one to sort of define, the heart, the blood vessels, how it functioned, where the blood went, all that sort of thing. But, he along the way developed this idea that compression was good for the circulation of the legs, and he wrote about that much more. So that was, again, back in the 1600s. The modern era of compression, and then eventually the development of compression stockings really didn't happen until the 1900s. And it happened a little earlier in Europe,
which always seems to be the case, doesn't it? In some respects,
in some respects, for sure. And with respect to the treatment of venous disease, it really is true.
Germany comes to mind, but they've been among the leaders, right?
For sure,
in some of that.
For sure. It really hasn't been until the last 30 years or so here where we've really kind of appreciated the extent of venous insufficiency and how it impacts people's lives, because it really does impact their lives. So anyway, onto the scene comes a guy named Conrad Jobst. Now, I think most people have probably heard of Jobst stockings.
I'm wearing a pair of them as we speak.
Yeah. And, Jobst stockings, I can remember very early on in my career, working in the hospital. And, Jobst stockings were the stockings that they gave every patient when they came into the hospital. Typically it was that white stocking. There was, a hole in the ball of the foot for whatever reason, I guess probably traction. And although the early Jobst stockings were not as, I think, high quality as some of the stockings we have today, still it was, it was a compression garment. We started to understand the necessity to address venous stasis, because when you throw people in the hospital, especially if they're having surgery, and the blood flow in their veins slows down. No question about that, because the immobility and because you're just laying around. So we pretty quickly figured out that compression stockings was beneficial. Anyway, so the Jobst stocking was named after a guy named Conrad Jobst. He was German. He lived from 1889 to 1957, and he's got kind of an interesting history himself. He was originally in Germany. He was a tool and die maker, basically. And he designed, very bright guy. He designed machines and all that sort of thing. He immigrated to the United States in 1911. By 1913, he became the chief engineer at a company called Ames Bonner Brush Company. And
not the Fuller brush guy, but the other brush guy.
Yeah, the Bonner brush. But that was in Toledo, Ohio, and he revolutionized basically the design and the production of the toothbrush.
Of all things, who knew?
Yeah, of all things. So prior to Conrad Jobst coming up with machinery and a process by which he kind of he kind of sort of put together the modern toothbrush. Toothbrushes were made from a bone handle, and pig
bores the hair or whatever
for the bristles. So he used this new thing called celluloid, and came up with the idea of boring out the middle of the handle and then sticking all these little synthetic bristles so that was very uniform, and obviously it probably looked very much like the toothbrushes we have today. So then he went on from there. He had he was an inventor. He had 40 patents, and he got into a lot of different things. So I guess the crucial thing there was that Conrad Jobst had venous insufficiency.
Okay.
And that's what kind of inspired him to, figure it out, figure out what could be done for that. Well, it's interesting in that he noted that when he went into a swimming pool, because of the hydrostatic pressure or the pressure of the water being around his leg,
sure.
He noted that his legs felt better. And so I think that's probably what then brought this concept of creating a garment that caused that a similar kind of compression to help essentially blood flow in your legs and make your legs feel better.
Incidentally, it's interesting you bring that up because I remember when I used to be a scuba instructor.
Yeah.
The same thing holds true when you're diving.
Right, sure.
The pressure, especially if you're diving over 3 atmospheres, if you're over 100 feet, the compression makes your legs feel really good, and it's easy to swim very strongly underwater because your legs feel better.
Yeah.
Amazing.
Yeah.
It is. Compression.
Right. So the other concept I think that Conrad Jobst probably can be credited with is not only the external pressure, but also this concept of graduated compression. Now, what do we mean by that? Well, we measure compression stockings in a unit of measure, which is millimeters of mercury. That's the same measure that we use for when we take somebody's blood pressure.
Okay.
That's measured in millimeters of mercury, 120/80 or whatever. Compression stockings, exert a certain amount of pressure, and they were constructed, and again, this was his concept, in a graduated fashion, in that the lower you go, down around the foot and the ankle, the pressure was the highest. And then as you move up the garment or move up the leg, the amount of compression diminishes. And the concept there is that pressure gradient is going to help propel blood in an upward fashion, which is where you want it to go.
But that's why probably when you mentioned earlier, a lot of the athletes are using just the sleeve between the knee and the ankle. Because that's a pump, right? That big calf thing.
Yeah, right.
So if you get that compression, it must mean that it's being more efficient.
Right. Yeah. So again, the compression stocking is made. It's produced in a very, very specific way. So, usually I warn people because, there's a lot of hack kind of stocking makers out there. It really is a situation where you get what you pay for. They can be, they're more expensive than just, some running socks or, some gym socks or whatever. But, they're well worth the additional cost. And quite frankly, actually, as time goes on, and I've noticed it just in the course that I've been, doing this, been in this business, is that the cost of decent compression stockings are definitely going down, and there's no reason why you can't get a good.
As a matter of fact, and I'll jump there because when I first started, I think the real good ones were like $75-$80 a pair,
right?
And that would be a deterrent. I must tell you though, you have to weigh it. You have to weigh it, and one thing I learned early is how to take care of them because they don't like to get beaten up,
right?
And so if you wear them and then you get home and you take your shoes off, you either take them off or put on a pair of slippers because if you start wearing them walking around on the floor, they don't last too long. I learned that the $300 way.
Yeah, right.
But I would not have a day go by anymore without using them.
Yeah.
And I think that was clearly, but that's why, isn't it that the issue? Maybe we can explain to that. You have to stop comparing them to the $6 for 3 pairs in the store because they're not, it's just different.
Yeah, absolutely different. Whole different ball game. So, why is it so important in vein disease? Well, we have to look at what is the basic problem with vein disease, or this thing that we call venous insufficiency. And it all has to do with the fact that there is failure of the one-way valves that are in the veins in our legs, which is a particularly important place for valves to be functioning properly. We have valves in veins all over our body.
Sure.
We have them in our arms too. But because of the fact that there is the most amount of hydrostatic pressure, especially when we're standing up, we're upright on the veins in our legs, the valves just become so very, very important. So, what happens is that the valves fail. Usually, that's a genetic thing, and rather than carrying or propelling blood upward, which is the direction it should be going, the blood in our legs starts to settle downward, and like I said before, it eventually makes its way back up. But the problem is that the veins in our legs start to act as a reservoir. And the veins are holding too much blood, and they're holding it for too long of a time, and then that's what creates the symptoms, and then leads to further problems as the process goes on. So,
and I call it, for me, gang, it's gravity. The longer you stand up, the more gravity takes place. So. However, there are many of us, and I'm one of them now, that particularly because of COVID, Doc, I know that a lot of people aren't able to do their normal stuff.
Yeah.
So they're walking and stuff a lot more, which obviously is great for your health, and it can almost be aerobic if you get your heart rate up a little bit while you're doing that.
Sure.
But now our people are discovering, hey, I think I'm going to use these socks.
Yeah.
Because I want to do 3 miles, not a half a mile. I don't want to sit down because my legs are tired.
Yeah. Yeah, and it really does affect people that way. I mean, you can definitely it does improve your stamina for sure. Yeah, we see that all the time.
And by the way, gang, I got to remind you, you're listening to the Vein Clinics of Hawaii show, Four Islands, and Dr. Julep, the medical director, and I do this every week. And if you'd like to learn more about this and even hear previous episodes or see the latest and greatest and some of the really neat things that are happening through Vein Clinics of Hawaii, go to veinclinicsofhawaii.com, veinclinicsofhawaii.com, and see all we got online for you. Dr. Julep and his gang have been working really hard on that website.
So the valves fail and the blood starts to pool in the legs, and what happens is that there's not only more blood and more fluid in the leg, but there's also an increase in pressure. The increase in the venous system starts to increase, and then that is what then leads to the veins dilating.
Sure. As
the veins dilate, the valves fail further. As the deeper veins, what we call the superficial venous system, which is not on the surface of the leg, it's a little bit deeper, you don't see it, but as the superficial venous system fails, that increase in volume and increase in pressure then gets transmitted to more superficial veins. And that's when we start to see varicose veins, spider veins. Visually we see that. And then also people develop the symptoms that we typically see with venous insufficiency, which are achiness, heaviness, fatigue, muscle cramping, restless leg syndrome, and et cetera, as well as, worse things that happen, which we'll mention here in a second. But so the pressure increases. As that pressure increases, that leads to not only accumulation of blood, but also fluid and inflammatory kind of molecules start to leak out into what we call the soft tissue of the leg, and that leads to swelling. And as that process continues, it leads to even further damage to the subcutaneous tissue and the skin of the lower leg in particular. The skin starts to turn dark and thick and kind of irregular surface, and ultimately it can lead to venous ulcerations. So that's why it's so important to address, venous insufficiency early, so that people don't get to that point.
So obviously there's some people that, and if you've listened to previous programs, you know that there is there's six different divisions of of venous insufficiency or vein disease. And one of the things that's going to happen here, the question always comes up, and I'm sure somebody out there is thinking about it. These stockings come in varying degrees. I mean, and sizes.
Right.
So I mean, you can't. It's not a one size fits all by any means.
No,
you need to get the right size, but also the right amount of pressure.
Right. Yeah. That's true. Absolutely. Yeah. So when people come in, we measure their legs. So there is a sizing process. And to some extent there is, we do kind of pick the most appropriate compression level for them. Now, the typical compression, level that we use is 20 to 30 millimeters of mercury. That is kind
which is not too bad,
Which is not too bad.
Most of us can wear those without too much discomfort.
Yeah.
I know where you're going with this, and I've got a great comment, but continue because I got something too.
But rarely do we go less than that. I mean, less than that isn't really having too good of an effect. But sometimes we need to go higher. Sometimes we need to go to the 30, 40 level. And that's for people who, have, bad venous insufficiency. Sometimes they have a component of what's called lymphedema, which often goes hand in hand. And some people need that amount, and we certainly use it. They're a little more difficult to get on and off, but they can be beneficial.
Yeah, and I'm in that gang. One of the things is that originally I looked at this next level up. They were difficult to put on. Sometimes they're difficult to get off. And yet it is a mountain. Once you've climbed it, it thinks, what am I complaining about? Look how good this makes me feel. But then I found out something else. And this is the comment I wanted to drop in. I found out several weeks ago one day, I got up and I have two different kinds of socks from Dr. Juleff. Some are open-toed and some are closed-toed. And it just depends. And he can explain what. But what I did was I put on my closed-toed ones, and I got ready to go out and got my shoes, and then I thought, wait a minute. I think I'm going to put on another one and see what. And I found out that the open-toed one went on so easy because of the closed-toed one was already on.
Right.
So putting a new one on, it's like right up. And what that effectively did for that day was double the pressure, right?
It is additive.
Yeah,
it's additive.
It may not have doubled it, but it certainly did increase it.
Yeah, I don't think it doubles it completely. I don't know the physics behind it, but it does. It is additive to a certain extent, and you're getting more compression for sure.
Yeah. So I thought to myself, the next plane trip you have, you're going to do that. I'm going to make sure to do that just because I'm so comfortable now with the one pair. Getting that second one on, and who knows? I don't know. Maybe I go down and ring the cash register some more at your place and get some more. Who knows? But I mean, once you do it, you do it.
Yeah,
that's what I like.
Well, there are when you first start, it's difficult. There's no question about that for most people. But I think there's little tricks along the way. You've got your own little trick about how you
and
get
this
it
is
on.
to a video coming soon on Doc's website because I got to show you my way of putting them on. It's so silly, you'll love it. It's just so easy. Boom, I'm done. Well, it used to take minutes. Now I'm out of here.
Yeah. Well, when I first saw you do that, I was very, very, very impressed. When we're in the office, we have this little device that makes it very, very easy.
I love that thing. Yeah.
But
do people use those at home too?
Sometimes they do. Yeah. It's a little more difficult to use it yourself. You really
need a little help.
You really need to do it, to somebody else. But that device makes it very, very easy. But there are little tricks here and there. I mean, you've got a very good system. Yeah. The thing that we teach most people, and this is kind of what I think you found with your closed toe, putting on the closed toe first and then the open toe after it, is that you had that little slipperiness over your toe, over your forefoot and your heel. If you've got a little bit of slipperiness over that part of your foot, then it makes putting the stocking on a lot easier.
Yeah.
So what we often tell people, and this just works with the open toe, is that we have them put a little plastic bag, like a baggie or whatever, over their foot, and so that it covers their toe and their heel. and then that's slippery enough. So
I love that. I'm going to try that.
Yeah, so that you get that you get the stocking started over your foot, and then after you get over your foot, it's pretty easy from there on.
And by the way, the reason why he said closed-toed is because you're going to remove it.
Yeah, well, that works only with an open toe, because then once you have the stocking on, then you pull the baggie, over your toes. Right. So don't try that with a closed toe. But so anyway, so what do compression stockings really do for vein function? Well, it helps vein function in a number of different ways. The first and probably the most important is something that you alluded to in your wisdom just a few minutes ago.
My infinite, it's all osmosis. All the wisdom he's talking about is just being passed from him to me. I just say it differently.
Well, you've learned a lot. But it is that the stockings enhance the calf muscle pump. Mm-hmm. This thing that we call the calf muscle pump is very, very important to vein function. And this is happening primarily in the foot and in the calf. And what happens is that when we walk or run or whatever, when we're using the leg muscles, the muscles contract. In that contraction causes compression of the veins that are running through those muscles, and that are between the muscle groups. And when the muscles contract and the vein becomes compressed, the blood has to move in one way or another. And when the valves are functioning, it moves upward. That's and that's what we want.
That's what we're asking. Yeah,
we've often said the vein or the heart pumps blood through the arteries. So it's kind of bringing blood from your heart to the rest of your body. We don't have a bunch of little hearts all over the periphery of our body to bring blood back up. So we rely on things like the calf muscle pump and one-way valves that are functioning. Now, when the valves are not functioning, then it becomes a problem. So that compression kind of helps move because it's graduated, because the compression is higher at the bottom and lower at the top. The calf muscle pump can, the muscle will contract and propel blood in one direction or another, and because that stocking is on in a graduated sort of compression fashion, then it will move upward.
Okay, I'm looking at all the body inside now. This is an insight Dr. Julep has given me. I'm taking a look here, and I'm thinking, all right, we already know that the heart, this pump called the heart, is operating 24/7, 365, or else you're in trouble. Mm-hmm. I mean, so even when you're sleeping, the heart's doing its thing.
Right.
But what about the calves? And what about, you're sleeping. I know we talk about restless leg syndrome, talk about some other things, but it seems to me like it's dormant. Mm-hmm. When you're sleeping, that muscle is, it's not doing what it's doing, but you're lying down.
Right.
So you don't need it as much. Is that accurate?
Exactly. Yeah. That is accurate. You don't need it as much. And, since you're in a reclining position, the blood is going to be a little more, it's not going to settle into the leg, and it'll probably, for the most part, make its way upward, because there are other things that also control vein or blood flow in veins, and some of it has to do with our breathing,
sure,
and our movement that we have that we don't recognize or feel, but we do have some body movement through the night. So for the most part, it allows for an adequate amount of blood flow through veins. And typically, even with venous insufficiency, we don't recommend that people necessarily wear compression stockings at night. It's not really of great import, but when they're up and around during the day, it's a whole different story. So again, first way that stockings help blood flow is that it enhances the calf muscle pump. The other thing is just that compression on the veins helps with the dilatation. Part of the decrease.
Wake up, gang! This is good.
Yeah, part of the valve failure again is because those veins are dilating, and if we can keep the veins compressed as much as possible, then we're going to enhance valve function as much as we can.
I know there's no such thing as a dumb question, and we do shows, gang. Some of our shows are just question shows, and we love doing them. I love doing them, particularly when you write in or email in and we get a question answered. I got this. I'm not sure that this is even in the game, but it's logically it would seem that the heart is asking for blood. I mean, right now the heart, this wonderful pump, which is doing this, is pumping the blood throughout our body, but it also needs to get it to pump it. How much suction is going on by that part of your body that says, I need this blood, so hurry up, give me the blood?
Your heart definitely needs blood return. There's no question about that.
So that's what the veins are doing.
Yeah. And I think that again, normal physiology, for the most part, no matter what we're doing day and night, there is, unless there's a pathologic process, there's enough blood getting back to the heart. Now, sometimes there is pathology such that adequate blood is not getting back to the heart, and a person can have heart failure due to that. But venous disease, by and large, it's a rare person where their venous disease is so bad that under normal circumstances, it's going to cause a lack of blood actually getting back up.
Okay.
Now, I have seen, a small number of, patients over the course of my career where it was a question as to whether it did impact, blood getting back to the heart. And because I can remember one patient in particular, he would have periodic dizzy spells. And he had very, very bad venous disease, and so we were kind of wondering whether what we call venous return, blood coming back to the heart, was really impacting those periodic episodes of dizziness. So theoretically, can it happen? Yeah, very periodically might it happen, but for 99% of people, it's usually not a problem.
I got to tell you, the other day we had a doctor call us up on my regular show, and what he said was really, really great, and it was about an instruction manual for seniors. And one of the things it said about a heart attack, about stroke, about vein disease, about a lot of things was that we get out of bed too quickly. That what you really ought to do is once you hit 60, what you should do is, first of all, when you wake up, don't spring out of bed, because if you stand up right away, you could faint, or you could have a stroke,
right?
And you can say why that is. But he said what you really want to do is you lie there and you think about it for a few seconds, and then you lower your legs off the side without no pressure, for a few seconds, and then you get up. So make that, instead of up to the bathroom, make it up, then 30 seconds to the bathroom.
Yeah.
Does that make sense?
It does.
It's interesting.
For sure.
Yeah.
Maybe sit up for a few minutes, half a minute.
Just a bit.
And then stand up and do it in a little more controlled fashion. But I mean, that's exactly what we're talking about. And it probably happens more as we age, because as we age, there is a greater incidence or a greater presence of venous insufficiency.
Sure.
So you stand up suddenly and all the blood kind of settles down into your leg, and that's exactly what's happening. That is affecting the blood return to the heart. And if the heart is not getting enough blood, it is not going to generate a blood pressure, for sure.
Now you got a problem.
Yeah,
but that's why, gang, when we circle the wagons to get back at the compression stockings, which is the subject of the day, is that when you're lying down, using those tricks like getting up slowly, elevating, and all of that stuff, pretty easy. But what about when you're not doing all those things? And that's why I want to tell you that. And because of my job, in my morning radio show, Doc, as you know, I get up at dark 30. Within 10 minutes or 15 minutes of waking up, once I jump out of the shower, those socks are on. And they're on until sometimes 9 or 10 at night.
Yeah.
So the question is, ideally, how long should someone wear compression stockings every day?
Well, I think it depends on the extent of their venous disease.
Okay.
I think the more you have, and especially in people who have a combination of venous disease and lymphedema, it becomes more and more important for them to wear their compression stockings probably as much as they can. So, you're doing it right. So the lesser amount, what I tell almost everybody, everybody that we treat, no matter how bad or no matter how severe or not their venous disease is, if they're working and if they can get in the habit of wearing compression stockings, at work every working day, that is going to benefit. If they do that consistently, then that's going to benefit them over the course of their lifetime, especially if they're young.
Yeah, and gang, the reason why we talk about this, if you listen, we talk about this almost every week. There are professionals, and there's people at every walk of life and every job of life that suffer venous insufficiency, and almost everybody is at one point in time or not troubled with the inability to stand up as long as they should, and that affects their job.
Sure.
It affects their health. It affects a lot of things. So this looks like maybe the insurance companies aren't too wacky when they say, has this person tried compression stockings? Or when you say to an insurance company, we are at a point with this patient where the stockings have helped, but we really need to go to the next level.
Yeah.
That would indicate, do stockings stop the progression of venous disease, or do they slow it, or why? How do they help other than wearing them every day?
The stockings don't correct the problem. That's the only thing there. But is it completely inappropriate that the insurance companies mandate that we do that? Well, no, not really, because there is some utility of getting the patient into the habit of utilizing these conservative measures, because even after we treat them with procedures, they're still going to benefit from conservative measures.
And gang, every now and again we get a patient in, and one time, a couple patients ago, couldn't wait to not wear the stockings anymore.
Yeah.
Well, and we told that person, this was a guy. The guy had a great attitude. We said, hey, you know what? You still have to wear them. Sorry about that, but you got to wear them. And that's me. There goes I. I thought, well, as soon as the swelling goes down, I don't wear them anymore. I don't give it a chance to get swollen anymore. I put the things on.
Yeah. So, now, is it going to correct the problem? No. Is it going to slow the process? Yeah, probably.
Maybe a little bit. Every bit helps.
But most importantly, if once you have your venous disease treated, and you get to a point where you're is kind of optimized with respect to vein function, is continuing to wear compression stockings going to affect the course of that in you for the rest of your life? Absolutely, for sure. So yeah, we encourage people to wear them even after we treat them, and the more severe the vein disease, the more we encourage them to wear them. Typically, even if somebody has real bad venous disease, I say, take them off at night. The benefit that you're getting from wearing the stockings through the night is probably minimal, and it gives your legs a break and your psyche a break too.
Yeah, and that's a great point, because I've every now and again I thought, I fell asleep with the things on.
Yeah,
it's okay.
Yeah. So we talked about the calf muscle pump. It helps that. It decreases the pressure in the venous system in general, again, because of that graduated pressure component of the stocking. It prevents what we call venous stasis, and that's what we don't want. We don't want blood hanging out in the leg, too much of it for too long, because it leads to problems. And it reduces damage to the vein walls. The longer that increased pressure is there, the more the vein is dilating, and the more the vein is dilating, and that's happening because of damage to the wall. And so eventually or ultimately, the goal is to relieve symptoms, and they do. They relieve the achiness, the heaviness, the fatigue, the swelling, cramping, restless leg, etc. And I think it's a rare person who, if they're really being honest with themselves, if they're up and around working and walking all day long, it's a rare person who can really say, oh yeah, I wore the stockings and it just made no difference whatsoever.
Okay, now I want to tell you, I tried that, and it's just plain not true. And the other thing is, and don't try this at home. I'm a patient, not just the host of the show with Doc, but I'm a patient, and I just really like the staff. I like everybody there. I like what's going on there. But what I think is amazing to me is somebody says, "Oh yeah, I wear those things all the time."
Yeah.
I don't have them on today, Doc, but I usually wear them.
Exactly.
You've heard that every which way but blue, haven't you?
Yeah. Oh, yeah.
Everybody
says that. Yeah.
Cat, kid, a kidder.
I ask because after we treat people, invariably if they come in and they have, they're saying, "Oh, we still have a little swelling or whatever." My first question is, "Are you still wearing your stockings?"
Oh yeah, every day. I just didn't have it today.
Yeah, exactly. I knew you wanted to see my legs, so I would. Anyway, so a couple of other things that the stockings will do is that it'll help lymphatic flow. Mm-hmm. Now we've talked about this thing called lymphedema, and lymphedema often goes hand in hand with venous insufficiency. Lymphedema is something also that creates kind of clear fluid buildup in an extremity, especially the legs. So lymphedema is one of those reasons for edema, for swelling. Mm-hmm. And compression stockings will help with that. So there's of benefit in that situation. And I think those are the people, in my mind, those people with fairly severe venous insufficiency and also a component of lymphedema, those are the people that really need to wear their stockings, pretty much all day long, every day. Yeah,
and you have seen them. We talked about this earlier in the show. You've seen them now popping into fashion. There's you can go online and find 20 million different kinds of compression stockings. Dr. Juleff, of course, has dispenses some from his clinics, and there are other things. But I don't think anybody is trying to get rich on making people wear stockings. Yeah. I think that as a patient, as my doctor. Isn't it sort of a relief when a patient comes in and at least has been doing that part? So know that all the little things you're doing to help them is because they're being proactive in their own treatment.
Right. Absolutely, yeah, and yeah, you're right. We do. It's not like we're trying to make a business out of selling stockings. We try to sell them as cheaply as we possibly can, and the stockings. We encourage people to get the stockings from us just because of the fact that we know that the quality is there.
That's what I was going to ask you about that next.
Yeah, there are stockings that people can get on the internet for $15-$20, and you're saving a few dollars compared to what you might spend in our office, but you're never quite sure about the quality, and the quality of the stocking is so important in achieving what we need those stockings to achieve.
Yeah, I got to tell you, it's so true because I was in a drug store the other day, and they will put in big print diabetic stockings or vein stockings, and I looked at them and they're socks.
Right.
And they have a little compression to them, and I think to myself, well, I'll try these. And then,
Yeah.
I will, because I already can tell just by putting my hand in one.
Right. And usually you can. When people come in with off-brand stockings, I usually, ask to see them, and you can just by stretching the stocking, you can, get a feel for how good they are or not.
When you talk about that, and I know this isn't part of our stocking discussion, but in some respects it is. There's been a tremendous number of people over the years, particularly athletes, and you see it more and more in basketball, volleyball players, track runners, everybody wearing this tape. The kinesio tape or whatever these things are. And they say that increases circulation. And what they're really, does it? This is something that you're not using in your office to my knowledge. Yeah. Is that some sort of a form of treatment as well?
Yeah, I don't know enough about that to comment, but I would say probably not. There's so many kind of quick remedies out there.
It's supposedly lifting your skin so you get better circulation or whatever.
I probably, if it's having some benefit, it's got to be minimal. Mm-hmm. Probably the salutary effect of that is nowhere near what you're getting. From
but athletes are going to try everything to get the edge, and that's why I'm so amazed at supporting what you've been saying as a practitioner, as a physician all of these years. These things have more benefit than you can ever possibly know. Sure. Look at the mainstream athletes and people that are realizing how valuable this is.
Yeah. Right. So the other advantage, or in the other situation specifically, where compression stockings are so beneficial, is their protection against DVT. During those times of immobility, typically we think of that in that situation. We think of people in the hospital. And, those people are, especially those people who have had surgery. We do a lot of different things in the hospitals these days that we weren't doing, 20 years ago to protect people from deep venous thrombosis. But, leg compression is one of those things. So we give them medication that interferes with their clotting mechanism and all that sort of thing. But compression is also a very important component. There are other situations also, and we talk about this all the time, of immobility, and people being on a plane is another one of those
number
things.
one. Yeah.
And so I encourage just about everybody to use compression stockings when they're on a long plane ride.
In today, I mean, when we look at COVID and all of the things that you need to do to keep yourself and healthy, I'm thinking that there's a lot of people that they're not going out, so they don't think about their compression stockings.
Yeah.
I'm staying home.
Right.
When I do, I put the darn things on and then put a pair of regular, gym socks over the top of them so they don't get all busted up. Mm-hmm. But don't a lot of people get off their routine, and as a result, ease up on what makes common sense to double up on rather than ease up on.
Right. Yeah. That's a good point. When you kind of work into your routine, something like wearing compression stockings, and then you don't have a routine anymore.
Yeah, no routine.
Then that's going to suffer. So so people have to be aware of that and kind of adjust their routine. But. And then the other thing is, again, as it relates to COVID, when people get ill and they're all of a sudden they're not up and around and active as they usually are, and they might be home in bed for a number of days. And I know this was not a patient. This was a longtime friend of mine who that happened to. I forget the illness, but he became ill. He then was home in bed for several days, and he developed a DVT that later developed into pulmonary embolism, and he died from that. Mm-hmm. So it's similar. It can be similar to people, going into the hospital. So I think that especially in older people, and especially if you know that you have venous disease and you have other medical problems, even if you're home in bed, ill for whatever reason for a prolonged period of time, wearing compression stockings would be of definite benefit.
We talked earlier, and before we run out of time, I want people to know, sort of what the options are. And there are closed-toed and open-toed. Yeah. And I also know that there's calf-high and there's knee-high, and there's also some thigh-high. So how do you determine which compression hose I should be using, or say grandma?
Yeah, well, that's a good question. I think the open toe versus closed toe is a personal preference. Mm-hmm. A lot of the women want the open toe because then they can wear shoes.
They wear sandals or whatever.
Sandals.
Yeah.
The men sort of tend toward closed toe, I guess, because that's just what we're used to. Then the compression again kind of depends on the severity of the venous disease. In general, we use 20 to 30 in most people. The thigh high versus knee high. When we're doing procedures, we kind of like to use the thigh high, the higher stocking, because we're working on the veins in the thigh also, and we have just found the compression over the area that we've worked on a vein is beneficial to the outcome of the procedure.
And by the way, in that I've done the thigh highs, gang, just because I had some of that work that he's talking about up high. It's nowhere near the compression at the top as it is at the bottom. You said, it's graduated from right around your ankle, the gaiter, where the discoloration and the ulcers and all those things happen. You really need a lot of pressure there. Yeah. But as you go higher up, I guess maybe because it's just different because first of all, the veins are getting larger as they're going up, right? Mm-hmm. And maybe they're flowing a little bit better. So does that sometime determine where people that you give the thigh highs for, geez, I don't want to do this every day. Yeah. Maybe that can be temporary?
Yeah, they are. Yeah.
Yeah.
And that was the other point I was going to make is that in the long run, when people are just, post procedure, post treatment, and they need to wear compression for in an ongoing sort of way, then I recommend knee high stockings. There's no reason to continue the thigh high. The knee high is actually as good as the thigh high for long term use.
Yeah, and by the way, but on a trip, I might tell you the difference. Instead of my open-toed little ankle ones, I'll wear the thigh highs because I'm going to be on an airplane. Why not?
Well, it probably does give you a little more protection in that setting for sure. Yeah.
Okay, so gang, listen, there is miles more to be discussed on these compression stockings. Now, we've done a whole show on it, but there's plenty more. And if ever you want information, you just go to veinclinicsofhawaii.com. That's veinclinicsofhawaii.com, and to get more. And remember, these things... when you start worried about the cost stock, and the final word is you don't have to worry about it breaking the bank because, like you said, in the last several years, more competition is better pricing. And if you looked at them when they're $70 or $80, $90, now they're half of that, and they're better.
And they're as good, if not better.
Okay, hope you enjoyed the show, and you'll come and see us next time. Remember the Vein Clinics of Hawaii, 4 islands. The Big Island, Maui, Kauai, and now, of course, right here on Oahu, and more to come. So check us out next time. We'll see you next time on the Vein Clinics of Hawaii show.
Well, that's our program for today, and we certainly hope you enjoyed meeting us. Please come back next week for our next episode. And in the meanwhile, to learn more, please visit our interactive website, veinclinicsofhawaii.com. That's veinclinicsofhawaii.com.